This is part 4 of the series of chest pain. You know, I said I'll be talking about several causes of chest pain. So previously, I've talked about the 4 causes of chest pain that should not be missed. If you have not watched that video, please do well to watch that video. For those meeting me for the first time, I am an emergency medicine physician. I see patients with acute and life-threatening illnesses every day. So this is what I do for a living. So today we'll be talking about pulmonary embolism. Now, what is pulmonary embolism? The best way I can explain this is that there are blood vessels that supply oxygen and nutrients to the lungs. Now, in a situation where those blood vessels are blocked, one of them, 2 of them, or more are blocked with a blood clot, it leads to pulmonary embolism. And how do you know if you have pulmonary embolism or not? If you have a sudden, unexplained shortness of breath, that's difficulty with breathing, you might be dealing with a pulmonary embolism. Understand that if you have shortness of breath and you've got asthma, there's an explanation to your shortness of breath. So it might mean that because of your asthma, that's why you are having shortness of breath, okay? If you've got pneumonia or some kind of illnesses rather, you will know that this is caused by that. But in a situation where you have sudden, unexplained shortness of breath, you might be dealing with pulmonary embolism. So, apart from the shortness of breath, what other symptoms can you have? Now, you can have chest pain. Now, the chest pain is typical in that it is sharp, okay? When you take a deep breath, the chest pain becomes worse. When you move backwards, forward, the chest pain is still there. You know, I talked about pericarditis, where I said once you sit up and you lean forward, the chest pain becomes better. But once you lie down and take a deep breath, it becomes worse. In this situation, even when you move forward, it doesn't become better. So this is typical of a pulmonary embolism. There are other symptoms that you can have. You can have your heart might be beating fast or irregularly. You might have other symptoms like lightheadedness, dizziness. But if you have this sudden unexplained shortness of breath and chest pain, the typical type of chest pain I've just described, all you need to do is to see a doctor and leave the rest for the doctor. Now, when you get there, what exactly will the doctor be doing? There are certain things the doctor will do. One, the doctor will do an ECG, because ECG shows a pattern with pulmonary embolism. The second thing the doctor will do is the doctor will send some blood tests. Depending on your risk factors, the doctor might send what we call a D-dimer. But when you've come with a typical presentation with a background risk factor, the doctor might not even send D-dimer because it doesn't have a good sensitivity test, okay? You might do straight up CTPA. So CT of the chest, basically, where you look at the blood vessels. Now that will give you the diagnosis if you are dealing with a pulmonary embolism or not. I know the next question in your mind will be that what are the risk factors to having pulmonary embolism? Note this. 1, if you've had a pulmonary embolism before, or you've had a DVT in the past. When I say DVT, I am talking about you discover that one of your leg is bigger than the other. It's a bit more painful, especially the calf, the back of it, and some other things. I don't want to go so deep into DVT today. So the risk factor, like I say, a previous PE or DVT is one risk factor. If you've had a surgery recently, is another thing. If you have been immobilized, when I say immobilized, you've been in one place for a long time, possibly a long distance travel. Maybe you've been on a flight for 12 hours or as the case may be, and you have other problems, background comorbidities like heart problems and all of that. So when you come, the doctor put all these things together to make a decision. And when pulmonary embolism is diagnosed, what do you do? there are medications that can be given to help with the treatment. Okay, we call them anticoagulants. In some situations, we can even use clot busting medications. Okay, and the last thing to do is surgery. You can use a catheter to go in there to remove it. You can do what we call surgical embolectomy. So there are several things that can be done. However, that should not be your concern. Your concern will be if you have these symptoms, the next thing you need to do, get to see a doctor, and the others will be taken care of. If you have learned something today, please like, share, and comment. I'll see you in the next video.